Hi guys, welcome back to my channel. Thank you for coming back to check in. Today I'm going to be talking about chemotherapy, what to expect when you're having chemotherapy. After I posted my last YouTube video, I had a couple of messages from people who unfortunately have just received a diagnosis. So I want to, give a bit more information for people who may be going through it and are very nervous and they don't know what to expect. So I'll just talk about my case. I can't, obviously, everyone goes through different things, so I can only talk about my own experience, obviously. So what happened for me, I had to go in to the Royal Marsden every 3 weeks on a Friday. But before I went in on the Friday, I had to go in on Wednesday for what they call clinic, which is they do blood tests. So I had to get there about 8:30 in the morning, and the clinic would be at about 11:30. Time for them to check my blood results and send them through to the lab, send them to the people, the doctors, and then they would check them and see if they're okay and let me know whether or not I had the go ahead to go on Friday. Because what happens when you have chemotherapy, it destroys all cells, so good and bad cells. So they want to minimize the risk of infection, colds, flus, etc. So they want to know that your red blood cell count is a good number. They also check your weight every 3 weeks, or in fact every time I used to go, they used to check my weight. They measure you to begin with, but they don't do that every time. And they do your oxygen level and also your blood pressure. So they do that every time. They take record of it to see if anything gets worse as you're having the treatment. So my first chemo session, oh my goodness. Okay, some of you have already had a preview because you read my blog. So those of you who haven't, you can see pictures and so forth on my blog. I'll put the link below or I'll put it up here. I cried like a baby. I didn't want to be there. I bawled. They had to close the curtains, give me water, hush me. Oh, this is your first session. I was like, yes, it is. I wasn't happy because obviously I had seen everybody in the waiting room and I knew what potentially was going to happen. I also opted for a cool cap. So it's this thing. It looks like, people who go horse riding, those helmet things. They look like one of those big things. They clip it under there. And, it's supposed to freeze the hair follicles, which restricts, it's supposed to let the chemo have less of an effect. It's supposed to restrict it's supposed to close it. I don't know. Look it up, man. It's supposed to stop your hair from falling out. Put it this way, it didn't work out. It didn't work for me. I had that the first time round, I think the first chemo session, I was in that hospital for, I think, about 4 or 5 hours, because what they do, they start by cannulating you. So I had lymph nodes removed from my left arm under my armpit, so I can't have any needles or injections or any heat or anything on this arm because it increases the risk of lymphedema. So they had to do it in my right arm, and I know that sometimes people choose to have a PICC line. It's about here somewhere. They'll have that instead of having instead of getting cannulated every week or every 2 or 3 weeks, how many sessions you have. But mine was in my right arm. So they give you a warm electric blanket that you put over your arm to relax your muscle, to relax your veins, I should say, to relax your veins so that they can find it easily. And also for when they put the chemo drugs in there, it doesn't, burn your arm. It kind of just goes through quite nicely. So I had to sit with an electric blanket on my arm. They cannulated me. Then they gave me a few anti-sickness tablets to take before the chemo kicks in. So I think that when they give that to you, it's about a 15-20 minute wait before they start the treatment. So when they do that, you kind of just sit. They're comfortable chairs. They're in the hospital that I was, obviously every hospital is different. They look after you quite well. You get like tea and coffee if you want, and biscuits and so forth, because it is going to be a long day. It's pretty much an all day affair. So when they finish that, they come with their drip machine. They connect to you, and you can just hear it drip, drip, dripping. It's plugged into the wall. You can go to the toilet, just in case you're wondering. You don't have to sit there the whole time. You can. It works when you unplug it. It still works and so forth. The first drug that they gave me, it was like a reddish colour, and they do warn you. They say when you pee, this comes out. It's the same colour, so don't be too alarmed if you see that your pee is turning red. Don't worry, you're not bleeding out or anything like that. Nothing's burst inside your system. It's just the drugs that are going through. And then they give you another one. I can't remember the name of the drugs that I had, but when I do, or when I go and research it after I film this video, I'll put it in the description box below, so people will know, just in case you have the similar drug to me, or the same one, you'll know pretty much what to expect. So you basically just sit there. I'm such a fidgeter, I can't keep still. It's really bad. It was just awful. I just sat there wriggling after I finished crying like a baby. I just had to sit there with my arm just wrapped over, and that stupid thing on my head that was so heavy. My neck was like this, and it was just uncomfortable. My first session was just not nice. I didn't like it at all. I was sat drip, 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 drip. And then what they give you, the first one that they gave me, they say to you, oh, you're going to have a tingly bottom. It warms up down your bottom and everything. It tingles. It's a weird sensation. And for me, then another one, oh gosh, I'm remembering now the more I talk about it. There's another one, I do not know the name of it, but when they give it to you, your nostrils start burning inside, and it just like, oh, this is horrible. It just feels like acid burn inside your nostril. Then I had the one where it made my stomach start feeling like it was on fire on the inside out. Ugh, shiver. Just remembering it is just, but I got through it. I'm still here. I have to say, yeah, praise God, I'm still here, because it could have been very different. So that's just my notes. It's not nice, but you know, at least I'm still here. Then, because of the cold cap, as I was saying earlier, it's an extra, I think it's an extra 45 minutes. I'm sure it's a total, I think it's an extra 15 minutes after the chemo, because what they do, they give you the washout. I don't know. I'm not medical, so I don't know the terms. But when they finish giving you the chemotherapy drugs, they give you like a drip that clears it out. I think it's kind of like water, but it just, yeah, that's that kind of drips, and then you're looking at, you can see the time, how many drips you got left, and you're looking, 3 minutes seem just so long, you just want to get out that chair. But even when the 3 minutes is over, someone needs to come and unhook you, so you're waiting, you're just like, hey, my machine's beeping, can you come and unhook me? It's just like, get me out of here. But yeah, the first session was not nice, but after the 15 minutes, the cold cap came off, and so I got unhooked and I went. So they had explained to me that there could be numerous side effects. I think sickness, feeling sick was one of them. I didn't feel anything in particular after the first session. I think it was after the second session, the second round, as they called it, that the side effects started to kick in. Now, my nails started to go brittle. These are side effects that are quite common, but what happened to me, my skin was really dry. My complexion was just all ashy. My nails turned black. My fingernails turned black. Hair loss all over. My tongue was really, really sore. It was just unbelievable. I couldn't taste anything. You could have fed me anything and I wouldn't have known. I had to rely on memory for taste. It was that bad. It was just like, and I didn't have an appetite, but I knew I had to eat, because I couldn't risk losing weight, because then it would mean they would delay the chemo even longer, and it was really, for me, it was really long enough. I didn't need to have an extension, so I needed extreme flavour. It had to be really, really, really like full of flavour with pepper for me to be able to just about taste it. My tongue had these purple sores all over them. I'll post the pictures, and of course the most common side effect, which is the baldness. So that didn't happen straight away. I started feeling like sore burns on my head. It was like, it was sore to touch. Anything. You know when you put your clothes on over your head, that was like, my head's hurting. Oh, it's really sore. And I noticed that everywhere that I could start feeling sore, a sore patch, the hair started coming out in clumps. It was just like, okay, there goes a clump of hair. And it wasn't just a little bit, it was just fat clumps of hair. That wasn't very nice. That wasn't very nice at all. And then I felt a bit queasy, but it wasn't anything that I could say was like dramatic. And obviously, bear in mind, in case you didn't watch my first video, and in case you've never read my blog, bear in mind that my chemo had to be, I started it and then I had to go back because I got pregnant in between, so it had to be postponed until my 3rd trimester. So the side effects are kind of like a big question mark. When they say to me, do you feel sick at some stage? I'm like, well, I do, but I don't know whether it's because of the pregnancy or whether it's the chemo. So do you tolerate symptoms more when you know that you're pregnant? I think maybe, you know, if you think it's your baby, you don't care as much. If it's something else, I just didn't know. So I guess I was lucky in that sense to have that. But anyway, one of the side effects that I can remember was utter fatigue. Now, you don't know what that word means until you've experienced it. Extreme tiredness. I couldn't move some days. I was just like, oh, I'm so tired. And I could sleep the entire day. And even having a toilet break would be a chore. It would be like, I had to psych myself up just to move. To even brush my teeth was just like, I'm falling asleep whilst brushing my teeth. It is just, I'd never experienced anything like it. Extreme fatigue. If I could say that again, with the emphasis on extreme, that was one of the worst side effects that I would say, because you don't want to do anything. You can't eat because you feel sick. You can't move because you're so tired, and joint and muscle pain. It's just, yeah, your fingers just lock up on you. You know what they call the repetitive strain syndrome, the repetitiveness. My arms, my hands just locked up, my joints, and everything was just aching me. It was just it was unpleasant, to put it nicely. It was unpleasant, and I wouldn't wish it on my worst enemy. Not that I have any. I'm just, I wouldn't wish it on anybody, because it was tough. And when I was reflecting, I just thought, wow, how do old people go through this? Because I mean, they're supposed to be more vulnerable. I'm young, as they kept saying, and they keep on saying to me, and that was some serious stuff. And I know they had mentioned that because of my age, once again, they were going to give me the maximum that they could. So any drug, it would be the highest dosage that my body could take. So it knocks you. It does really knock you. And just when you're about to recover, you go back again for your next session. So they've worked it out very, very well. It doesn't allow you to relax at any time. It's just as your body starts weaning out the drugs, boom, boom, boom. So you just like, yeah, if that makes sense. So, I would say for anyone who's having chemotherapy, keep a positive mindset, because at the end of the day, that, I believe, is the thing that will keep you going and will heal you the quickest. When you have a positive mindset. If you are somebody who is quite negative, then you're going to have a worse experience, in my opinion, because I think you have to be positive no matter what the situation is. So healing begins in the mind. So I point blank, I refused to believe that I was ill to begin with. You'll see, if you look at my previous video, you'll see how many times I was like, yeah, you guys, see you later, I ain't coming back. So it was just like, I had to convince myself, I didn't have to convince myself, because that's the kind of personality I have anyway, but I had to, like, put it in here that, it's not that bad, and all those medications, because that's another thing as well. I am not advocating, I'm not telling you not to take what the doctors give you. That's your personal choice. I chose not to. So they gave me a big bag of, I'm not exaggerating, I wish I'd have bought it, because I still have it. They discharge you with a massive clear plastic bag full of drugs that here's your anti-sickness, here's your anti-joint pain. If you feel this, take this. If you feel that, I was like, listen, what are you trying to do out here? This is too many drugs. And every time I used to go to the clinic, I don't even care if you don't watch this now, but they used to go, did you take medication? I'm like, yeah, of course I did. Please, I didn't take another pill. I would, I would sit there and bear the pain, like, I know it might sound a bit like, why would you do that to yourself? But I'd say at the end of the day, our bodies are designed to kind of deal with things. If you are always blocking pain, then how does your body learn how to cope? That was me. That was my mindset. So I thought about it. I just thought it's a bit much. It's a bit much to be giving me these drugs, and then when you read the side effects, it can say you can become addicted to these drugs. If you feel that you're getting addicted, speak to your healthcare team as soon as possible. I'm thinking, what are you prescribing me? This is too much. Like, chill out. So it's not nice when you're going through it. So yeah, let me just try and remember what I'm actually filming this video for, taking myself away. So those of you who are going through chemotherapy, I'm sorry that you're going through chemotherapy, because I know what it feels like. However, you will get through it. It's not as bad as it seems after the fact. So now that you're going through it, try and keep a positive mindset. If you're worried about anything, talk to your friends and family. If you have close people that you can share things with, or talk to the Macmillan nurses or the healthcare team. They're very, very good at offering advice and so forth. You can even contact me if you want a random stranger to give you advice and to help you out, to give you jokes, or to I'll try and be funny to lighten your load and so forth. But keep strong. You'll be fine. You'll be fine in the end. And the next video that I will be filming and talking about, the next stage of the treatment after the chemotherapy for me was radiotherapy. So if that is also what you're going through or going to potentially go through, I will record a video about what to expect when you're having radiotherapy. Okay, but in the meantime, thank you once again for coming back to my channel. Don't forget to subscribe. Take care. Oh, before I say peace and see you later, don't forget that life is a blessing. So no matter what you're going through, just think to yourself, I'm alive. Because as my husband says, your health is your wealth at the end of the day. There's nothing more important than that. So if you've got your health, no matter what you're going through, number one, it could have been worse, but the most important thing is you're here. So enjoy life. Don't stress. Take it easy. Really, what I say to my kids at school, it's not that deep, okay? No matter what it is, it's not that deep, okay? Take care. See you later. See you soon. Peace.